Hi, this is Dr. Sudeep Roy, board certified facial plastic surgeon here at Refined Dermatology. This video will briefly overview the procedures that we offer for hair restoration. Generally speaking, the concerns that we see from our patients are of a receding hairline or areas of thinning among the scalp. This is both in males and in females. This pattern of hair loss is generally attributed to hormonal loss or sort of androgen hormone loss. And although we offer a wide variety of medical therapies to help allow for additional growth and transformation of thin vellus hairs to thick terminal hairs, that certainly helps to maintain density of the scalp. We do offer hair transplantation in patients that have sort of plateaued as far as their hair loss is concerned, are interested in reconstituting or rebuilding their frontotemporal hairline, which is the hairline that frames the top of the face, or who want to address thinning or balding in the areas on the top of the head or the vertex of the head or the crown of the head. Although we do perform a limited number of strip procedures, which is essentially a procedure that involves removing a portion of hair-bearing scalp from the back of the scalp and harvesting or isolating hair grafts for implantation. We have moved away from this generally because of the additional recovery that is involved, both from a swelling, bruising, and pain standpoint, as well as other postoperative risks such as numbness to the scalp. The incision involved for a strip procedure is also fairly long and horizontal, and although it generally heals very well, it can certainly be noticed if patients wear their hair very short. The majority of procedures that we perform related to hair transplantation involve a follicular unit extraction. We have the most advanced automated manual devices available on the market right now. And essentially what the procedure involves is isolation and harvesting of individual follicular units. Follicular units are essentially natural groupings of hair that grow on the scalp, anywhere from 1 to 5 hairs, generally speaking. And so what we do is we go in and we harvest these individual follicular units. And these involve punches that are less than 1 millimeter in diameter. After the harvesting is done, depending on how many grafts are necessary to achieve the desired outcome, implantation sites are made. Once the implantation sites are made, the grafts are, after being processed and curated, are then implanted into the areas where we are trying to add additional hair density. Hair transplantation is really the only way to achieve new hair growth in areas of complete loss. It is a one-day procedure with minimal discomfort and minimal recovery. Generally speaking, my patients only need to use pain medication for the first few days, most oftentimes as a sleeping aid at night. There is a bandage that is in place for about 3 days, after which patients can wash their head but not shower, because direct shower pressure can certainly affect and dislodge implanted hair grafts. So patients are allowed to shower normally at about 10 days after the procedure. The donor site, which is the back portion of the head in most cases, heals up very quickly, and in about 7 to 10 days, there is very little evidence that anything was done in the back of the scalp. Some scabbing in the donor site as well as in the recipient site occurs and is seen, but this generally lasts about 7 to 10 days, after which scabs fall off. And patients are really able to resume most activities, especially concerning the hair, as far as washing and shampooing with the products that they're accustomed to using. Activity restrictions are generally in force up to about 2 weeks, after which patients can resume any activities that involve increasing heart rate and blood pressure, lifting, exercising, air travel. Once the hairs have anchored in and all the sites have healed, patients can potentially experience a little bit of shock loss or shedding of the implanted hairs as well as the neighboring hairs at about 2 to 3 weeks. after which new hairs from those implanted bulbs will start growing. This process is generally slow and can take several months for the hairs to reach a length to be able to impart density. Most patients can start appreciating the density from the new hair grafts at about 9 or 10 months, sometimes sooner, sometimes later. Every procedure that is done here at the practice is performed with platelet-rich plasma injections as well. Think of it as a fertilizer to the newly implanted grafts, as well as a very profound medical intervention on hairs that have already been subject to hormonal influences and potentially would be lost if it were not for some sort of medical intervention, both oral or through PRP injection. So all my patients that undergo hair transplantation do also undergo simultaneous PRP injections to help with their natural hair growth, as well as for optimal hair health for the implanted hair grafts.